Isaiah once said, the greatest gift you can give your family and the world is a healthy you. So today I want to ask, are you making the healthy you your number one goal? Welcome to Family Health Foundation Talk Show, where we are dedicated to promoting everything about good health, well-being, and family life. My name is Sharon, Okrah, and I will be your host. Welcome back, and thanks for staying. This is still the Family Health Foundation Health Talk Show. Now, what do you know about stress management or depression? Today, on our very first episode, we're talking about everything that has to do with how to deal with stress and depression. And I have with me here on the show Dr. Jude Ayambila, a resident in psychiatry from the Okrah Psychiatric Hospital. Thank you very much, Dr. Jude, for coming.
The pleasure is mine.
How are you feeling? How has work been?
It has been okay, a bit stressful, but I try to cope and do what is within our personal.
And how is Okrah Psychiatric Hospital generally?
Challenging, there's a lot of work out there, a lot of mental health conditions out there to be attended to. And Okrah Psychiatry is the main psychiatric facility or also the center of training in Ghana. So the workload is quite a lot. It's quite demanding. We strive to give the best of healthcare to our patients.
I must say, you doctors are doing a lot out there. You must be really, really commended for that. And thank you once again for coming. So today, we want to talk about stress management and depression. And it's one of the number one leading factors when it comes to mental health, generally as humans. First off, I want to ask, when can we say one is stressed?
Stress, in simple terms, is a normal reaction of the body to a challenge, which may be perceived threatening. Perceived to be a threat, or actually a threat. So that is how the body usually responds to certain situations which we find challenging. Under those circumstances, the body secretes certain hormones, mostly cortisol and adrenaline, and this in a way makes you hyper alert and aware of your surroundings. It also sort of mobilizes glucose in your body to give you enough energy. And then what it also does is to make your heart pump faster to supply enough blood to the essential parts of your body that is required for such a challenge. So you realize that sometimes when you feel threatened, there are certain activities that you are able to undertake, and at the end of it, you wonder how you're able to do that. Maybe jumping over a very big gutter when the car is about to hit you, you do that and you wonder how you're able to do it. It's the effect of the stress. Okay, your body was able to respond under such a threat, during such a threat, to help you overcome that situation. So basically, that is what stress is all about.
Some of these symptoms that you have outlined, are there any particular types that one can identify when it comes to stress?
Yes. So there are different forms of stress, okay, or different circumstances under which stress occurs. Stress broadly is put into two categories. We have acute stress and then chronic stress. The acute one is is to help you cope with more recent, or more how do I put it? Activities that are quite demanding, but then are not, the durations are short. Usually it lasts less than 1 month for such a situation. So if it persists more than 1 month, then that tends to run into the chronic cause of stress, which can actually result in certain illnesses. So with stress, there are certain circumstances, okay, that usually we encounter it. We could have timing stress or time stress where you feel like you have a deadline to meet, but you don't have enough time for that. So under those circumstances, you feel everyone almost encounters this. So you have exams and you're supposed to read. You feel like there's so much to read and it's almost time, so you get stressed. That's one of the circumstances under which
you end up trying to finish the entire semester within 3 hours.
You realize that under those circumstances, you're actually able to read more and even understand it better compared to when you have a whole lot of time at hand from the beginning of the semester to study.
That's right.
So under those circumstances, due to the activities of the body in response to the challenge, you're able to actually do the work better or read more compared to circumstances prior to that. Also, we have anticipatory stress. This form of stress is usually encountered when you anticipate or perceive an event that you think may be unfavorable to you. So for instance, you have a PowerPoint presentation and you think that you are not well prepared for it. So in such circumstances, you anticipate that you may not do well, so you get stressed during that.
Okay.
Yeah. We also have encounter stress. Okay. With encounter stress, that one is when you meet people or groups of people that you think that communicating with them or interacting with them will be a problem. So you have issues with interacting with those people. And this is mostly seen in healthcare workers and other forms of social workers who interact with a lot of people. So in a way, they are overloaded. So taking for instance, a doctor going to sit in the consulting room and having to talk from morning till afternoon or evening. So that's a lot of load on the doctor. So that is what we term as encounter stress.
Encounter stress.
Yes. And the last form of stress is situational stress. This is usually encountered under certain situations where you find yourself in a way, let me put it such as a tight corner. So for instance, you're in a meeting and the place is chaotic. Everyone is involved in a heated argument, and at the end of it, everything falls on you. So what happens to you? You are stressed out because you are left with the responsibility of handling whatever is happening.
In the heat of the moment.
Yes.
That's true.
So that is situational stress.
Okay.
So under these various forms of stress, they present with certain symptoms. So stress could present with physical symptoms, it present with emotional or behavioral symptoms. So the physical symptoms we commonly encounter are the headaches. So some people come, my head is aching, but this is usually due to a stressor. When I say a stressor, it's the thing that causes the stress.
Right.
So when they're exposed to it, then they get the headaches. So we could also have fatigue or general body pain or even muscle pain, okay? Sometimes even joint pain. So one common thing that we tend to associate these symptoms with is malaria. Okay, sometimes a lot of people are stressed, but they think they have malaria because malaria commonly presents with these symptoms, and malaria is also common in our environment.
Okay.
So people tend to associate the physical symptoms of stress with malaria. So you could even have poor appetite. The appetite could be poor, or they complain that their mouth is bitter, they have this bitter taste in their mouth. So these are physical symptoms of stress. Then their heart beats fast, that we call palpitations. They have fast respiratory rates, they breathe very fast and shallow. Okay. Then when their BPs are checked, it may be elevated. So these are the physical symptoms of stress.
Okay.
Some even have poor sleep, which is more of a behavioral. So they either sleep little or some even sleep too much. Yes, they may have poor or low concentration. Then some are very irritable. Sometimes even the least provocation or even unprovoked, they get angry and then
overly emotional.
Yes. So those are the behavioral patterns of stress. Yes. So stress can affect us in various ways. Sometimes we don't understand what is actually going on, but these are the symptoms of stress that we actually are going through.
All right. That's an interesting one. Let's move a bit to students and children. So the psychological distress in the general Ghanaian population is high, with 18.7% of the sample reporting either moderately 11.7% or severely 7.0%. Now, few studies have measured explicit depression levels among Ghanaian students. So, to what extent really can a student realize that he or she is at the verge of almost breaking down as a result of stress?
Okay. So every individual, is different. Even identical twins are not the same.
That's right.
Our coping mechanisms are different. We are built differently. What is good for you may be bad for me. There are certain things that may be considered as positive for one person and negative for another person. Yes. So this is the key thing, is that you have to know yourself and then intervene early, appropriately. You don't wait to get to the stage whereby it gets to a chronic point or results in an illness or any form of mental disorder or physical disorder before you now try to seek help for that. The most important thing is that we intervene early. When you notice these physical symptoms that I described earlier on, or the behavioral symptoms or emotional symptoms, you try to reevaluate yourself. And see. You may not be able to see where it's coming from, but then there are experts who may be able to help you in that regard. So if in general you have this feeling that you are not in the right state of health, so you seek medical care from the professionals, which are the doctors. You go to the hospital, then you seek the professional care. But if you have the slightest of idea that it's stress you are going through, sometimes what you need is to talk to someone. You just need to talk to someone about it. And that may, in a way, be the intervention before you even get to any breaking point. So when you get to a breaking point, then there's a burnout, which we usually want to prevent from happening.
Okay. So, as a doctor indicated, there are some people who might want to talk or approach you with their issues. So, anytime, any day, any time at all that you get a random text or call from any person and it's quite urgent, or it always starts with, "Can I talk to you? Can I open up to you?" Please give the person a listening ear. And over to you, doctor. Is stress truly, or is it really manageable?
Yes, stress is manageable.
Also,
stress usually has a stressor, okay? The cause of it, the underlying cause that precipitates it, okay? So identifying it, when you're able to identify it, you may be able to manage it depending on what caused it. But then there are several other things that you can do by yourself, and not just going to see a professional for medical care or help. So first of all, like I mentioned earlier, you have to know yourself. Knowing yourself is very important. You know your limits. That doesn't mean you shouldn't push yourself in order to achieve your goals. But you have to know your limits, so that when you get to that point, you try to slow down so that you don't break down. Okay. Set goals for yourself. Okay. You have to set goals for yourself and prioritize your activities or those goals, so that you don't end up wasting time on things that are actually not essential. When you do that, you are able to manage your time well, and you don't encounter any other form of stress, especially the time stress that I was talking about. Exercise. Okay, exercise is very key in managing stress. Exercise doesn't only just keep you fit or increase your stamina. It has its mental or emotional effects as well. When you exercise, what happens is that your body, okay, produces some chemicals, okay, called endorphins. These are natural painkillers, and what it does is to relieve pain, relax you, and it can even elevate your mood or even motivate you. So that's how come you find that people who exercise, sometimes after they exercise, you see them in an elevated mood. You find them very happy.
That's true.
Yeah. Exercise also has the added advantage of raising your self-image. So when you go to a gym, you start to build your muscles, well get out muscles, your six packs, flat tummy. This sort of boosts your confidence, it builds it up. Okay, so that in a way has a positive effect on your self-image. So these are the positive aspects of exercise in regards to your emotions or your mental health being. Exercise, we all know, reduces the risks of certain physical illness like hypertension, diabetes, stroke, and heart attack. So these are the advantages of exercise. It could be in the form of jogging or other rigorous forms of exercise, as in when you hit the gym to lift up weights. It could also be yoga. Yoga is there, it's a form of exercise.
Very relaxing.
Yeah. So a 30-minute walk will suffice, and a 15 to 20-minute walk of other regular exercises are also okay for an exercise as an activity. Aside exercise, one could also try some deep breathing exercise as well. So with that, you take in deep breaths. Normally when you are breathing, you use your chest, the muscles in your chest to breathe in and out. So you don't actually see much movement unless maybe you're actually in any form of distress. With this kind of breathing exercise, the deep ones, you use your abdominal muscles. So you take in deep breaths in and out slowly.
Okay.
And you feel your tummy rising and falling. So you do this. When you take it in, you hold your breath for a few seconds. Then you release it.
Okay.
So you can do this for about 5 to 10 times. Okay. And you can do it several times in a day. And this will help to lower the rate at which your heart is beating, can even reduce your blood pressure, and prevent certain effects that may be associated with the fast shallow breathing that comes with stress. You know, sometimes when you breathe very fast, there are some people when they are stressed, they may get anxious, and this is associated with breathing very fast. So you see them breathing very fast, panicking. Okay, this could cause pain in their fingers, pain and paresthesias, these tingling sensations in their fingers or toes. Their fingers may become stiff, or even they may feel some pain, stiffness in their jaws. So this deep breathing exercise helps also to prevent that as well.
And this works for the types of stress that you mentioned.
Yes,
okay.
It works.
That
doesn't mean it's 100%.
To some extent.
To some extent,
okay.
When you are stressed, some of them, not all actually.
Okay.
Some will help you. This may help under certain circumstances when you are stressed. Okay. Then sleep. Sleep.
My favorite.
Sleep is very important. Yes, in a way, it refreshes our mind, it reboots our mind because the human body is not a machine. So you need adequate rest. So about 6 to 7 hours or even up to 9 hours of sleep a day.
In this economy.
Yes, so that amount of sleep is good for your health. Okay, your diet. Yes, your diet. That's equally is very important. We tend to, let's say you are what you eat.
Yes, definitely.
We tend to sometimes not be conscious about the kinds of food we eat.
That's true.
So, eating less fatty foods. Less fatty foods. You have to also be cautious about the carbohydrate intake, but then your vegetables are equally very important. And your proteins, yes, are very important. When you complement this with the exercise, you will see an improvement in your state of health. Yes. Some people find it soothing to talk to other people when they are stressed. Talk to someone who is willing or ready to listen to you. And then should also be a trusted person, a trusted friend, or if you think that you don't actually trust people enough to talk to them for the fear that whatever you tell them may go out there, you can talk to the professionals. Doctors are available, especially we also have psychologists and psychiatrists who are ready to listen to whatever you have to tell them. And the good part of this, the positive part of this is that it's confidential. Whatever you discuss remains between you and that professional. So your secret is safe with them. So others also tend to write down their feelings or their emotions, and this in a way helps them. That's how some people have diaries and they write down whatever they are going through. It sort of helps them. So it's what works for you.
So first of all, know yourself.
Yes, know yourself. Then meditation. Meditation is a whole different thing together. That's mostly sometimes you need to be taught how to do it. So there are actually a whole lot of books and even videos on it. Can look that up. That's a whole different thing field. And we have another form of exercise, and the progressive muscle relaxation. That is also a bit difficult and it needs practice. Sometimes you need to be taught before you're able to do it, and possibly an assistant. It involves you tensing a lot of muscles in your body, relaxing them. So for instance, you may have to wrinkle your forehead or close your eyes shut for a few seconds, or maybe about 15 seconds, and opening them, lifting your tongue and applying it to the top of your, or the roof of your mouth for about 15 seconds, tensing your abdominal muscles, arching your back. So it involves a lot. You have to go through this for several muscles from top to down.
Relax.
Yes. And when you're able to do this during the process, or the event that you are stressed, when you do this, in a way, it helps you to relax. Yes. So these are things you can do on your own. But when you find that they are not helping, you seek professional help. You go to the hospital, seek professional help from the professionals, the doctors, and mostly the specialists in that area, the psychologists, the psychiatrists, they are able to handle that better.
Okay. But Doc, I think you left out one point.
Mm-hmm.
Money.
Oh, yeah.
Money is a great stress reliever.
Yes.
Because I don't know, I think that's happened with me on several occasions.
Okay.
And just by the mere sight of money, I was okay. It came like a healing. So, would you also say same?
Yes, if financial distress, okay, is a major form of, it's one of the common causes of stress, okay, it's a big stressor. So, having a lot of bills to pay, school fees, rent, when rent is due, then you begin to get headaches.
Yes.
And when someone gives you the money, then those headaches
it's like magic.
So yes, if someone is in the position to give you that money, why not?
So you are tested with that. Sometimes it works.
Well, yes, as long as it gets to solve your financial problems, which is the headache for you, then it works.
So just like the doctor said, if you are taking down notes, make sure to include money. And you mentioned school fees. It's great that you did. So because I want us to talk a bit about parents and their children, especially younger children. They also go through some form of stress, I believe. So what really would be your advice to parents when it comes to helping their children out and managing stress levels?
Okay. So parents tend to want the best for their children.
Exactly.
But sometimes in doing so, they're actually doing more harm to them rather than good because of certain decisions that we make for them. The expectations from some parents are usually too much and sometimes even unrealistic. Failure is not an option to some parents. When you fail in an exam or certain aspects of your life, then it becomes a problem. To the extent that some may even disown you, which shouldn't be the case. In life, you either win or you lose. When you lose, it isn't the end of life. The most important thing is getting back on your feet and then trying again. That is what parents have to let their kids to understand. When they understand this, there may not be too much pressure on them such that they end up being stressed because they know that it's just one outcome. The outcome is to pass. So when they fail, then it becomes a problem. Then they worry a lot about it. They trying to anticipate what their parents will do to them. Some of the parents may even be physically abusive, which happens. Okay. Verbal abuse, yes, is common. All sorts of words are rained on them. They are useless, good for nothing. I pay this amount of fees for you, and here you are, not being able to pass your exams, or you are wasting my money. So the expectations should be sort of realistic. And then every individual is the same. Is different. You have to know the strengths and weaknesses of your kids. And then tailor your expectations towards that and work with them. The outbringing of your kids make them who they are. When you raise them in a certain manner, you may predispose them to easily being stressed.
Which is also a reflection of you, the parents.
Yes. Yeah. Very good. So the upbringing of kids are very important. You end up giving them certain personalities. Their upbringing has an effect on their personalities. Some become very anxious. They are unable to interact with people. When they go out there, it's a problem. They can't interact with people. They see people, and then they become restless or anxious. It's a problem. So, in as much as parents want the best for their kids, they should try to treat them differently based on their strengths and weaknesses. Focus on their strengths and try to also build on their weaknesses so that at the end of the day, you don't end up harming them in order to when you are actually trying to help them.
Okay. Okay. I hope parents will also take note of these pointers. Now, I'll let us go on a break, but I want us to also delve a little bit into the home. When I talk about the home, I mean for my couples. Now, stress in a way has been noted to bring a lot of issues, and mostly it ends up bringing issues like distance creation, recoiling, some even leads to infidelity. Now, both partners may be stressed at the same time, and I don't know how possible this is, but I believe as human as we are, we can always tell when someone is actually going through something, especially if this person has been living with you for a very long time. So, what would be your number one advice for partners who may experience or may have to deal with their other partner also going through some level of stress?
Though I'm not just going to give them one advice, but several.
Please do. We want to reduce the rate of divorces,
Yes.
so please do.
So, first of all, you have to be attentive, pay
attentive.
attention to your partner. When you pay close attention and there are certain changes in the behavior of your partner, you'll be able to pick it up. Sometimes what they want to hear, what they want from you is to just ask them what is going on. There are some who will willingly come to talk to you, but there are others who want you to ask before they talk. So it depends on your partner. But then the person who is stressed has to also talk to their partner. You should be willing to talk to your partner, and your partner should be willing to give a listening ear. There are some who are always too busy to actually sit down to listen to you, and that doesn't help much. So you have to be willing to find time for your partner.
Okay.
And that is found helpful.
Okay.
As listening, people tend to talk and then relieve certain things of get certain things off their shoulders. That should be helpful for some people. Also, you should set relationship goals. It could be a common goal that you want to achieve, or it could be individual goals, but at the end of the day, it benefits both of you. And you should prioritize them so that there's no conflict as to which one comes first or which one this will benefit you and it's not going to benefit me, or because this is benefiting you, I don't want you to do yours first because that is benefiting me, I want to do mine first. So you have to compromise and prioritize them so that you either achieve them one at a time, or if they can be done concurrently, then that can be done. Hobbies.
Great hobbies.
Hobbies, yes. You should be able to do certain things in common, or even if you can't have such hobbies together, you can do it individually or with your friends. This applies to parents and children as well. I think I didn't mention that. Some parents actually don't allow their wards to engage in any forms of leisure or hobbies.
Sure, especially in this digital age.
Hobbies are very important. They, in a way, relieve stress. So when you engage your senses, so for the sight, you watch a movie, you listen to good music, smell good scents, okay, eat good food, even a hug, even a hug can sometimes relieve your stress. So when you sort of engage in these activities, they help to relieve the stress under certain circumstances. Though not always the case, but engaging your senses can be very important. Yes. So I mentioned exercise already earlier when I delved into it. The couple could engage in that as well. So either do it together or you have your separate routines that you do. So all in all, the bottom line is that know what works for you and what works for your partner. Know your patterns or your routines. You should be able to detect that there are some changes in your partner. So stress can present with irritability. So your partner comes home, is angry, is already angry, without any provocation or the slightest provocation, then they are angry at you. Then they may start to be verbally abusive. This is someone who used to be very calm and collected, argue with you in the first place. So when someone starts to do this, you should know that there's a problem and you should try to find out what the problem is. So if you try and it's not working, then you seek professional help. We have counselors who are trained in that field, especially for couples therapy.
Okay. Thank you so much, Doc. And I believe we heard it all for ourselves. We'll take a quick breather. When we come back, we'll be talking about depression. Stay tuned. Thanks for staying. You're still watching the Family Health Foundation Health Talk Show, and my name is Sharon Brown Okrah, and I have been talking to Dr. Jude Ayambila, a resident in psychiatry from the Okrah Psychiatric Hospital, about depression and stress management. And now we want to talk about depression in details. According to the World Health Organization, it's a mental disorder, and globally, about 5% of adults suffer from this disorder. Now, the interesting thing is, women tend to get more depressed than men and have been noted to be one of the leading causes of suicide.
Studies have shown that women tend to have depression more than men. And certain theories or factors have been noted. Some of these are women tend to be restricted, have a more restricted role in the society, whether socially or occupationally. The trends are, however, changing. Back in the day, it was severe compared to now. Now women tend to take a whole lot of roles and at liberty to do a whole lot of things compared to previously. Another factor is that women tend to internalize things. When I mean internalize, they tend to assimilate the feelings and beliefs of other people compared to men. Men will rather project their feelings or beliefs onto other people compared to women who do that. So with that, women end up ruminating, in that they are thinking a lot about what has happened, and they tend to think too much or put too much meaning into certain things that they may even have to let go, compared to men who, let me put in quotes, I don't care. They have this I don't care attitude. They tend to just forget about things or let things go or slide. Women also have this hormonal factor. It's been postulated that the hormones, in women play a role in depression. So that is how come women tend to have this premenstrual euphoric syndromes, whereby prior to their menses, they tend to have these mood changes. And also, women who have given birth tend to have this increased rates of depression. That's where we have the postpartum depression. So under these circumstances, the reason behind it, or the reasons that have been postulated, is that the hormones have a role to play, and the hormone that has been implicated here is estrogen. However, there are some people who have the belief that it may be about the same level, just that women tend to report their cases, or report their symptoms, compared to men who refuse to report it when they have it.
Someone once told me that probably because women have a lot of problems. Is this true? I didn't agree with him on that, considering the fact that I'm a woman myself. And do you think this is so?
A lot of problems is relative. There are men with more problems than women.
Yes.
A lot of problems. Everyone has a problem. That's is very vague. Yes, not entirely true. Yeah.
Certainly not entirely true. Now, I want us to talk about the differences and perhaps the similarities between trauma, sadness, and depression. Do they share any form of similarities or differences?
I wouldn't say differences or similarities per se, but then there may be some connections between them.
Okay.
Maybe interrelated in that one may predispose you to another. So let's take trauma for instance. So it's how you respond to certain perturbing events. So if you are physically assaulted, or even let's say emotional abuse, or someone who is raped, this traumatic event can predispose you to depression. Though it can make you sad, even the other forms of trauma can make you sad, but then this is also a risk factor for depression. For sadness and depression, sadness is just an emotional state, but then the depression is an illness or a disorder. Sadness will affect how you function at home, in society, and at work. It will affect all those aspects of your life, especially when it's moderate or severe. Usually the mild forms of depression tend not to affect people much, but the moderate or severe forms tend to affect them socially and occupationally, compared to sadness that it's just an emotional state at a point in time, usually a reaction to an event, maybe grieving or loss of a loved one, which may occur, and then maybe you are broke, can make you sad. You failed an exam, it can make you sad. All those are normal reactions. But then this could become prolonged, and when associated with the other symptoms of losing interest, low energy, poor sleep and appetite, and decreased confidence, that results in your depression. In depression. Also, one thing that tends to run through the tray is sadness. With trauma, people tend to feel sad about events. Already sadness, you are sad, and with depression too, people tend to feel sad. So that runs through all of them. There could also be loss of confidence in trauma, and this can be found in depression as well. Yes. So yes, there are some similarities and they are interlinked, such that one can predispose you to another.
Okay. Now, talking about the treatment options, first of all, how long is the treatment, and what are the best treatments that you can recommend as a doctor?
For the treatment modalities, when treating depression, there's an approach, even mental illness in general, we have an approach called the biopsychosocial model, where we have a biological aspect that drugs are given, psychological aspects where psychological therapy is given, and the social aspect where you deal with the social life of the person and may even involve the friends or the family members as supportive care for the patient. So with regards to the drugs that can be given, we have different types of drugs. I don't want to bore you with the details. And these drugs are very effective. So we have first line ones. If they don't work, there are different types that we also use. So depending on the severity of the depression or even the individual, the drugs are always tailored towards the individual because there may be certain factors about the individual that may contraindicate the administration of certain drugs. Maybe if someone has a condition like hypertension, you may not want to give a particular medication because that medication may worsen or complicate the hypertension. So these drugs are quite effective and a lot of research have been put into them. So it's a matter of the consistency. Sometimes people tend not to adhere to what is being prescribed. And they say take it once a day or twice a day, and they end up taking it once a day or once a week. But then you're supposed to take it consistently, they're prescribed, because a certain amount of it is supposed to be in your blood in order for it to be effective.
Okay.
So adhering to the the dosage regimen is very important.
Okay.
Yes. The psychological means. Okay. So it's not just the antidepressant. No, the drugs given are called antidepressants. Though there are also other drugs that may be given depending on how the patient presents or the symptoms that the patient presents with. There are some who may have psychotic symptoms where they may be delusional or hallucinate. So that's how severe depression can get. People can see things or hear voices that are not actually present. Others may actually believe that people around them are trying to harm them or are plotting evil against them. So that's how severe depression can get. Yes. So under those circumstances, antipsychotics can be added. For those who have poor sleep, we have other drugs that are given to help them with the sleep. And coming to the psychological aspect, what we mostly do is to educate the client. So when you understand your condition, you will better comply with treatment compared to when you don't understand what is going on. So you educate the client on the condition, what the condition is about, the prognosis, what the person is supposed to expect, and even on the drugs, the side effects of the drugs, what to expect, and how to deal with the side effects. When that is done, there is better adherence to it. The client is also can be sent to the psychologist where psychological therapy is administered. So they'll be taught certain behaviors, how to let go of certain behaviors that are putting them or propagating or perpetuating the illness, and also to learn new ones that will prevent it or that will improve their well-being. They also taught to let go of certain beliefs they have or certain feelings that they have that may have an effect on the illness. So psychological therapy is equally very important. And then we have the social aspect where family supports and even the friends are also involved, because these are illnesses that you need support from other people mostly in order to be able to overcome it. So that's the reason why they are involved. When the family know what is going on and understand what is going on, they can in a way support you compared to the family that doesn't understand what is going on and can actually precipitate the depression or even be the cause of the depression, because sometimes the depression may be as a result of family issues. So when the family is involved, they understand what is going on, they can actually supervise the client in the taking of the medications as well. So it's not just the individual role whose role is important, family role is here. The encourage them to eat, to engage them in conversations, in their hobbies, and this in a way sort of lightens or help to elevate their mood.
Okay.
Yes.
Okay. So on that note, thank you very much, Dr. Ayambila. Jude Ayambila. I almost missed that part, but thank you for your time and thank you so much for the words of advice and the podcast. So I've learned a lot, and I believe my audience also have. And Dr. Jude Ayambila is a resident in psychiatry from the Okrah Psychiatric Hospital. You know where to find him anytime you have any similar situations, or you know anybody who is going through it from stress level or depression. My name is Sharon, and this is the Family Health Foundation Health Talk Show. Thank you so much for joining. Do comment, like, and share. Tell your friends about us and the good work we're doing for you and for the whole world. Thank you for joining us. See you on our next episode. Bye bye.